What I like best about working for Mortenson Dental Partners is the fact that I can run my practice the way I want to run my practice, and I get to focus on the patients. And I can't express that enough. It is such a joy to come in and know that my patients are my number one priority.
Something else that's been great about working for Mortenson Dental Partners is that the commitment to their patients spills over into their commitment for their doctors. And I've always felt that way. It wasn't just trying to get me to sign. Now that I'm part of the team and if I need anything, if I need any help or any support, they have a support center that's always here, and I have direct relationships with people who work in that support center.
They put an emphasis on family and friendship and just kindness with their patients. There are so many things that I love about Mortenson, I really can't describe it into words, but I do feel extremely lucky to be here, and I plan on being here for the rest of my career.
I didn't want to work for a corporate structure that was all about money and not about the patients. And one thing from the very first encounters I had with the company, we make sure we value our teams, we value our patients, our core beliefs and our principles align very well with what I believe and that it should be.
I love the fact that everyone was so friendly and welcoming and warm. It wasn't like I was going to a job. It was as I was going to hang out with friends and family.
The culture just seemed to really fit what you would expect in a private practice, but on a broader scale. And I think that really clicked with me, and I think a lot of my classmates could see that. We got to meet Dr. Wayne. He's a very genuine person.
We are so large, so there's a lot of people, but the culture is still the same across everyone. So you might meet someone in patient services and then meet someone in insurance, but you'll still get the same warm experience. We don't just sell you a dream. It is truly what we say it is.
My original plan was to work for them for a couple years and then buy my own practice. But I've stayed 6.5 years now because it's worked out so well.
One of my concerns working for a DSO was that maybe I wouldn't have as much say in the patient care. I had some friends who were working for DSOs. I had some good colleagues of mine that were working for DSOs, and they warned me about this as well. And so it was something that I was worried about coming into Mortenson.
Even though it's a larger company, it's not too big to the point where I'm just a number. I feel like it's still small enough to the point where how I feel really matters, and I get the individual attention that I need while I'm working, and it still feels like I own the dental practice.
Is that even though there's a corporate structure that helps hire and manage the HR of the company, we still have a large say in who we have as a team.
And so that's been a really important part of my happiness working here, is that I feel that I can deliver the care that I know my patients need.
Everything that I've done with the practice, every procedure I've done on a patient has been of my own volition. It's not something that somebody else was telling me to do, and that was really important to me.
It's group but not group. There's nobody telling you kind of what to do, what you need to do, but if you have a question, you not only just have the person that you're working with, but you have a whole range of doctors that you can kind of bounce ideas off of.
It is great because I'm part of the very strong team and I feel totally supported, and it's my office and I do everything the way that it's supposed to be according with the AAPD guidelines.
Not only am I a part of a group and a family, but my voice matters. It's not that I'm working for a corporate company where they tell me I have to do this procedure, or I need to look more into this, because I feel like some corporate companies do that. They push production, and here it's not like that. I do what I want to do. I do what's necessary for my patients.
For me, I wanted to be in private practice, but without maybe some of the debt that goes along with having to buy my own practice, but still have the autonomy and ability to invest and have some ownership.
Having support services around it's just light years ahead of any dental practice that you see working on its own. You have so many great minds and so many people willing to take care of your patients and help you through your practice and the growth of your practice, that it's really just a huge plus.
Another great thing about working for Mortenson is the onboarding process is very smooth. It's been very easy, it's been very seamless and very organized. From the minute I signed up, everything just went according to plan.
My family is really important to me, so I love the fact that I can go to work, and when I'm done with the work, that's it. I can go home and relax, and I don't have to think about anything like insurance aging or whatever you might have to think about if you owned your own practice. It's just strictly, I go to work, I come home, and relax.
Because there's mentors and other things in the practice, that it allows you to expand the amount of dentistry or the type of dentistry that you would do and you can feel confident doing.
For example, this morning, one of the general dentists came over and is doing her first Invisalign case and wanted some help with a ClinCheck. So it's so nice to work with other doctors so that you can, work with each other and just go back and forth and ask questions and things like that.
Well, for instance, we adopted my daughter last year. And if you've ever gone through that, you get the call in the middle of the night and you have to kind of drop everything. And so for me, I had instant coverage. I had someone that, I knew that my office and my patients were taken care of. I didn't have to call around and use a temp service. So it was a huge relief just to have that network of dentists that would help me at a moment's notice.
The big benefit for me is that I'm able to gain and more focus on my clinical skills than to have to worry about how the business is doing and how I'm going to grow the business.
I don't have to worry about hiring or firing somebody. That is nothing that I was ever interested in doing if I were to be in my own practice. And not only that, but there's quality of applicants that come through.
Especially from the specialist side of being an orthodontist, we really depend on referral, a strong referral source for patients, and being part of a big group allows us to have a built-in referral basis.
I'm so thankful that I actually work for this company so that I know that it's getting handled, and it's getting handled in a professional way, and I don't have to worry about it all being on my shoulders. I get to focus on patient care.
So I think that it's great that I work in an environment where I can have a lot of fun with kids, but I'm also providing a lot of dental care to people that really need it.
The culture just seemed to really fit what you would expect in a private practice.
Mortenson approached me and we started talking about the opportunities that were here, and we found a good fit and allowed me to grow the practice and gain some skills at the same time. We
started the practice with 2 days, and it was Mondays and Wednesdays. And then little by little, it has been it's gonna be 4 years next year. So it has been growing, and it's just so encouraging and so cool to see how you can grow your own office and start from point zero.
We all do very, very well in this line of work because of the patients and because of the great care we give, but also and the patients are the most vital part. It's important that we help take care of the communities that take such good care of us and allow us to live very rewarding and very good lives.
Well, one of the things that I realized in coming out of dental school was that I didn't know everything I needed to know in order to be a good dentist. And so continuing education was very important to me. And as part of Mortenson, I've been able to attend many continuing education courses that helped me and my patients.
And an opportunity that I had in 2011 was to take a IV sedation course, and Mortenson Dental Partners actually paid for that course for me. And since I've done that, it really has opened up a lot of different things that I wasn't able to do before. Not only sedation, but being able to do large treatment plans and taking care of patients who otherwise wouldn't be taken care of because of the fear factor that goes along with dentistry. It's been very rewarding, and Mortenson Dental Partners values that increased level of care that you can give as a sedation doctor.
Educationally, Mortenson has allowed me to grow not only clinically, but as a leader and as a person.
If there is an area that you feel weak in or that you're not fully comfortable in treating cases, they will seek out those continuing education classes to help you. I know personally, I've been to endodontic classes, pedo classes, oral surgery classes, and Mortenson has really made a priority of equipping their doctors with everything they need, to be successful.
In my opinion, it really is not even fair with where we're headed, because if if I were the brightest mind coming out of dental school and I was looking for an opportunity, to me it would only make sense to be a part of Mortenson and have the resources, the autonomy that we feel that we have, as opposed to some of the other group practices.
One thing that's also been really great for me is that Mortenson offers a guarantee for their new doctors so that you know when you're treating patients you don't have to worry about dollar amounts. And when you're strapped with pretty substantial student loans at the beginning, as most of us are, it's something that really makes a difference, so that you feel that you can deliver the care that you need to deliver and not worry about the compensation because you know it will be there.
And I know how expensive it is coming out of dental school and starting your own practice, because I've had a couple of classmates who did that. Some were successful and some weren't. And being part of a group really was enticing because you shared in that risk in order to gain a reward later on.
The ability to buy stock in the company is a tremendous way to accumulate wealth from the standpoint of the dividends that we may receive from the profits. And also, as the company grows, there's the opportunity for that stock to grow as well as any annuity would.
I became an owner in Mortenson Dental Partners because, for me, being married to an accountant, we could see very, very quickly that vehicles of wealth and growth for our family over time are becoming a little bit more limited.
And being a shareholder, you share the responsibility of, and you become more profitable in the long run because you're all working together to attain a common goal.
Ownership was important because I wanted something for the long haul. And when you're in private practice, you fund your own retirement. You have a team of accountants that takes care of that for you. And so I know that my retirement's taken care of, and I don't have to stress about it and work 6 days a week to make that happen.
It is an extraordinary opportunity that the Mortenson gives us to be part of the company, to own the company.
We always have to have the end, think about the end in the very beginning, because we do have a finite career, so there's going to be a lot of time after our career is over, and we want to plan for those things as well.
If I had any advice to give to people who might be thinking about joining Mortenson Dental Partners, look at the doctors. That's the number one thing I did when I was evaluating it. The doctors are so happy. It's just a really, really great company to be a part of. I'm very happy that I am.
My advice for someone considering Mortenson Dental Partners would be to keep an open mind. There's a lot of talk here and there about corporate dentistry, and I would say to give it a chance and see what it's really like, and meet some of the doctors and go into the practices. It feels like a family practice, so it's been a great thing for me.
The advice that I would give is have fun, enjoy every day. It's a blessing to have the privilege to care for people while we make a very good living. Dentistry is so much more enjoyable for you and the patients when you have fun.
And I would say, as a new doctor, you're nervous about whether you're going to be able to keep up, whether you're going to make it in that quick private practice experience that everybody makes out corporate to be. But that's not the case. I mean, our private practice is just like any private practice out here. It just so happens to be that we're in a group that is able to lend some support services.
Try to do the best you can to be open and flexible to a lot of different things. Be willing to continue to learn and educate yourself.
Dr. Will Engelman is a mentor of mine, and he said that the 3 things that you need to do are take care of your patients, and take care of your team, and take care of your community. And at Mortenson Dental Partners, that's what I can focus on, and that's what I love most about it.
Audio Jungle.